Okay, I see a lot of exciting things in the chat, a lot of names, a lot of new faces. We're so excited to have you all join us today. We're going to go ahead and get started because it looks like we have a lot of attendees present with us today. So we're very excited to get this going. I'm just going to hit the next slide. Okay, so welcome, as I said before, to SAYA's Racism and Health Literacy Symposium. Thank you so much once again for joining us today. This three-part series is conceptualized as an online march for health equity. Yesterday at session 1, we explored the role that narrative plays in framing racism and health literacy. Today in session 2, we'll highlight and amplify anti-racist health literacy best practices. And then tomorrow's closing session bears witness to powerful stories of racism and health literacy and provides tools to help us all change the narrative. So this Racism and Health Literacy Symposium is a part of SAYA's call for a racially just healthcare system and an end to the discriminatory health literacy and health communication practices that often leave patients and caregivers of color unseen, unheard, and unhealed. So just a few guidelines as we begin. Please be kind. Please keep an open mind. Stay on mute and feel free to speak out in the chat box, as I said before. You can also share your thoughts with us on social media with the hashtag RHL23 listed right there on the screen. And we'll also drop a PDF of the event program into the chat, or you can find it on our website at www.saya.org. And just another note, if you have questions today for the panelists, please use the Q&A function, not the chat, so that we can kind of organize the questions and make sure that we see all of your questions and get to all of your questions at the end of all the panelists' presentations. Okay, so here's the agenda for today's session: anti-racist health literacy in action. We have introductions, followed by 5 panelists representing a variety of systems, institutions, organizations, community-based programs, and individuals, each discussing a different way to practice, promote, and support anti-racist health literacy. Like I said before, we're going to leave some time for a brief question and answer session before we close. So if you have questions for the panelists, use that question and answer function on Zoom. Finally, when the session is over, we ask that you contribute to the learning by filling out a brief evaluation about the event, and that you share in these evaluations any reflections or thoughts that you have on the program today. So, as your host today, here's a little bit about me. My name is Jay Dickinson. I'm currently the Narrative Competency Lead at SAYA. I'm a graduate of Howard University, and I received a master's degree from the Narrative Medicine program at Columbia University. I have a passion for serving underserved populations and for achieving health equity and social justice in healthcare in today's society, and I plan to continue my education by earning my medical degree. So during the pandemic, I worked as a medical scribe in an urgent care clinic right here in New York City, where I routinely observed the profound asymmetry of knowledge, skills, and power dynamics between community members and their care providers. So this is part of what sparked my interest in health literacy and what led me to SAYA. So SAYA is a nonprofit organization that was founded in 2007. We're dedicated to improving the lives of patients, caregivers, and communities by improving health literacy. So SAYA's impact and influence is really and truly grounded in our community work. We have provided in-person workshops to more than 12,500 community members at over 60 host sites in the New York metropolitan area, from Head Start to hospice, from Latinx high school students to LGBTQ+ older adults, from cancer survivors to the newly diagnosed. We have learned a tremendous amount from the people that we serve. And these lessons really inform the education and training that we've provided to more than 2,500 frontline professionals in health literacy best practices. So these lessons are also embedded in our plain language health literacy materials, which I'm very proud to say have also been translated into 8 languages. And they're embedded in our online programs and events, just like this one, that we host to help professionals deepen their ability to understand their patients, their clients, and their communities, and enhance their ability to communicate across health literacy divides. So for those who cannot see the pictures on this slide, I'm just going to explain. There are some photos of SEA's work in the community that we'd like to share, including a Cantonese language workshop on how to use the ER safely and effectively, a SEA staff member helping 2 older adults understand a healthcare proxy document, and a Spanish language health literacy workshop at a community center in New York City. So SEA works to help people gain the skills needed to be health literate, or as Janet Ohene-Frempong said yesterday during session 1, to be as well as they can be. Specifically, SEA empowers patients and caregivers with our workshops, curricula, and materials. We train frontline health and social service providers in health literacy best practices, as I said before, including plain language, universal design, teach back, narrative competency, and narrative humility, which Dr. Sayantani Dasgupta discussed yesterday in her keynote speech. We provide plain language and accessible design services and consulting to help ensure materials are accessible to the broadest possible audience, including the nearly 1 out of 2 adult Americans who are functionally illiterate in the face of the healthcare system, which is kind of crazy when you think about what that number really means. So we also advocate for policy change to ensure that health information and services are easy to access, understand, and use for all that need it. So just another note, today's symposium is held in solidarity with the national observance of Dr. Martin Luther King Jr.'s birthday. For those who are unable to see the screen, once again, I'll explain. There's a picture of Dr. King with his words written out that he spoke in 1966. It's a very powerful message that says, "Of all the forms of inequality, injustice in health is the most shocking and the most inhuman because it often results in physical death. Racism kills, and today we will hear from people working to change that." All right, well, as Fallon gets that queued up and ready to go, I am going to introduce our wonderful, amazing next speaker here at the Racism and Health Literacy Symposium today. Anqunette Parham from Rockford Ready, a program of the Health and Human Services Department of the City of Rockford, Illinois. So as a part of her work at Rockford Ready, Anqunette Parham oversees the City of Rockford's community-wide health literacy initiative, made possible by a $3.6 million grant from the U.S. Department of Health and Human Services Office of Minority Health to fight COVID-19 and improve health literacy among racial and ethnic minority and vulnerable communities. She is a second career attorney who earned her JD from the University of Chicago School of Law. She also has a background in public health and has a very unique skill set that blends research, legal analysis, and policy development with leadership experience in direct care and program administration in community and clinical settings. Right, so we're gonna get this set up for you all.
Thank you. While we're waiting on Fallon to pull up the slides, I'll just start by saying thank you very much. I greatly appreciate the opportunity to be here today to participate in SEA's conference. This is wonderful, and I would love to share just a little bit about my background before we get into the work of Rockford Ready and just really how we are utilizing anti-racist practices with regard to health literacy in our community. As you mentioned, Jade, I am a second career attorney. I began my career actually in healthcare services, working in adolescent substance abuse and mental health treatment settings. And then from there, I spent 12 years at a federally qualified community health center doing HIV counseling and testing and prevention work, as well as managing a healthcare for the homeless program before I moved into more administrative roles. So, but I was always passionate about policy. And in fact, my educational background in undergrad was biology and sociology and women's studies. So I was pre-med. So by the time I got out and started my career, my good friends were all doctors in training. But one of the things that was so interesting was that we quickly understood about each other and about our roles was that It really wasn't these clinicians who were making some of the very critical, high-level decisions. That really, it was important for me that my experience on the front line could help to inform critical decisions that were made at the policy level, and just really to ensure that the people who are making decisions about how the most vulnerable segments of our population are being served really had a heart for those people, because it was abundantly clear that a lot of times the administrative and policy and legal decisions that are made with regard to healthcare were not being made by folks who were passionate about the people whose lived experience mattered the most. So with that, I took that passion to law school and studied health law, and became really passionate about this area and doing this work and kind of bringing all of these skills to bear. So this work with regard to health literacy and helping to empower and educate our communities with regard to the knowledge to help improve their health outcomes is really a passion project for me, and has been for a long time. So I'm grateful to be here and bring my varied experience to this discussion today. You can go to the next slide, Colin. Next slide. So the Rockford Ready initiative is actually a program that is led by the City of Rockford's Health and Human Services Department. As Jade mentioned, we are funded by the U.S. Department of Health and Human Services Office of Minority Health through a health literacy grant. So on this project, in partnership with the University of Illinois at Chicago College of Medicine, as well as the Office of Health Literacy and the UIC College of Medicine here in Rockford, we have done a lot of the groundwork in actually creating a health literacy task force that includes a number of trusted leaders here in the Rockford community, some from faith-based organizations, some from community organizations, as well as other longstanding healthcare partners and healthcare serving organizations. So this initiative is really something that is, Rockford Ready is an organization that is for the community and by the community. And so as we proceed with a variety of initiatives that we engage in, we always do that from a community-centered perspective. So our task force is critically important with regard to the messaging, the way that we access the community outreach workers that we utilize. They're all fueled by the perspectives and the lived experience of the members of our health literacy task force. You can go to the next slide. So again, what we do in this project, we understand the importance of easy to understand health information and services. So what we do in Rockford Ready is the promotion of health literacy, as well as in providing information and education around COVID-19 and COVID-19 vaccination, and encouraging members of our community to be vaccinated. We work hard to ensure that we're providing culturally and linguistically appropriate and relevant materials. One of the things that's very interesting about this work that we do, so we do have a particular focus with our initiative on African-American as well as Hispanic or Latinx residents that are in particular zip codes that were highlighted during the baseline research for our project. So these are in target zip codes that have been disproportionately impacted by COVID-19 infection within our communities. So we're looking at communities that we know have had a direct impact by a lack of health literacy and how it's leading to particular health outcomes in those areas. So in that way, we've been able to kind of focus our work and really target in on key areas that have experienced the most disparity. Again, for this grant, it was particularly around COVID, but as I'm sure many people on the webinar would understand, that played out to a number of other pathologies as well. So some of the things that we've done, stay there, thank you, include engaging young residents in the conversation on health literacy. And we developed a poetry series with the City of Rockford's Youth Poet Laureate. And so in doing that, We've also highlighted practical applications of health literacy in some of the other community events and elements of engagement that we've done here, including engaging residents to prepare questions ahead of their doctor's visits, as well as helping to empower residents that have limited English proficiency to ask for interpreters, and really provide a number of resources in a variety of languages, and not only to work with patients, but also to work with healthcare organizations, to work with community health workers, to work with other community organizations with regard to the roles that they can play with helping to improve health literacy in our communities overall. Our strategic communications plan has included a number of strategies that include a radio show, social media, out-of-home ads that also bring a number of trusted voices from our community to the forefront to lift up this topic and really give volume to the importance of health literacy and what it means for people who look like us in our community. Next slide, please. So again, this particular initiative around Art Meets Health, which is the development of the poetry series by our poet laureate, we took a number of data points from international organizations that have advanced, this issue of art meeting health. And a number of these organizations have really promoted the importance of art serving as a vehicle to both not only address issues, but also listen to communities that may feel disenfranchised. So that was a key part of our effort in terms of partnering with Juliana, our young poet laureate, and that she is a young Latina, and just really giving her an opportunity to elevate her experience and for her voice to be heard with regard to her interactions and experiences with the healthcare system. So this model concept of collaborating arts and health proved to be a beautiful way to really give voice and empower some of the young people in our community. I will give credence to a poem by Elspeth Murray called "This Is Bad Enough." Perhaps we can get that, I'll add that to the chat here once I'm done talking, but it's a wonderful poem that really served as kind of the inspiration for this partnership that we went into with Juliana and asking her to share her own experiences. But I'll put that in the chat for those of you to check out. Next slide, please. You can keep going. So this is Juliana. She is in school right now. Otherwise, we would have loved to have her join us today, but she is finishing up her senior year here at Auburn High School in Rockford, Illinois. And so she has done amazing work in her time as the Youth Poet Laureate here. She was the 22 Poet Laureate for the City of Rockford. And she indicates she's always really been surrounded by language, particularly Spanish and English. She grew up in a Mexican and Puerto Rican household, and that helped to influence her love of language. And she's been published in the Young American Poetry Digest in both 2015 and 2016, and she earned an honorable mention with the National Scholastic Art and Writing Award in 2017. She is still currently working on her first novel, and here at Rockford Ready, we have no doubt that you all will be hearing more from Juliana on a national stage. So we look forward to her future publications. Next slide. So we're going to share one of her poems with you all. So you can go ahead and
me dice que no. Me dice que está bien y que preguntas y preguntas solamente le confunda. Le digo a mi padre, le pido a mi padre, le pido que pregunte si no sabes lo que viene, ¿por qué te da vergüenza de pedir la ayuda que necesitas? Esto le digo a mi padre, le pido a mi padre. No quiero ver el sol de tu cuarto en el hospital, no quiero ver la luna de la ventana arriba de la ciudad, y cuando descanses, no quiero que el ruido de las ambulancias afuera de tu cuarto te caigan hasta que duermas, cuando solamente necesitabas pedir ayuda. Jargon. If I wanted strings of letters, I'd eat alphabet soup. soup. But they gave me a diagnosis, a word that my Scrabble board won't count, that doesn't give me closure, it just gives me doubt. Don't leave me hanging on for more explanation. Say it all right here, right now, and don't spare my feelings. I know you know how to rip off a Band-Aid. Can you just do that for me? For us? Say it up front how it is, and don't leave us hanging on for more, having to resort to articles online that make us think it's far worse or far better.
So as you can see, Juliana is incredibly talented, and this has been an amazing opportunity for us to amplify her voice and really help to highlight the importance of health literacy, and even for young people. And that's something that she's passionate about and we're passionate about as well, really helping young folks to know that it is important to learn to be your own advocate, even at an early age. These are skills that we want to help instill into them, that they can take on into adulthood to help see more improved health outcomes. So it's been a pleasure working with her. Please follow us on social media at rockfordready.org for our website, or follow us at Rockford Ready on Facebook. And we also have some of her additional work there as well. So we look forward to seeing you all in the future, and look forward to seeing great things from Juliana. And we're grateful for this partnership. Thank you.
Thank you so much, Anqunette. Thank you, Fallon. Thank you both for the work that you're doing, and the entire Rockford community, and here with us today. We're so grateful. So next up, we have Dr. Tyree Oredein. She is a director on the SEA Board of Directors. Since 2005, Tyree Oredein, pronouns she, her, hers, has dedicated her work to serving people of color, LGBTQ+, and other marginalized communities in health, social service settings, schools, corporate spaces, and society at large. She's developed and delivered a wide array of workshops and trainings to health and social service providers, educators, administrators, law enforcement, corporate personnel, parents, youth, and community members. So prior to starting her organization Left Turn Village in 2020, she held positions with Hudson Pride Center and later Garden State Equality. So Dr. Oredein is also an adjunct professor at Montclair State University in the Department of Public Health. She also sits on the board of directors, as I said before, for SEA, this organization dedicated to increasing health literacy. What Makes You Feel Beautiful, an organization created to empower women and non-binary people, and the Wesley Racial Justice Initiative, an organization created by an independent group of Wesley College alums engaging in anti-racism work. Dr. Oredein also co-leads the development and implementation of the Wesley Racial Justice Initiative's programming. She earned her bachelor's degree from Wesley College, her master's of public health from Hunter College, and her doctorate of public health from Rutgers University. Once again, it's my pleasure to introduce Dr. Tyree Oredein.
Thank you so much, Jade, for that lovely introduction. Good afternoon, everybody. Thank you for having me. I just wanted to go ahead and share my screen really quickly and hope that I don't have issues. All right. And sorry, can people see my screen? Okay, perfect. All right, so I just wanted to start off with a really quick video. Now, I might be dating myself, and that was not my intent to let you all know how old I am. But if people are familiar with Billy Idol, I'm not sure. If you can just throw in the chat if you know who Billy Idol is, Billy Idol, not Billie Eilish. So if for those of you who don't know, Billy Idol is a rock star, very, very, very big in the 80s. And for those who know Billy Idol, yes, thank you. I love seeing that people know, yes, my timeline. So Billy Idol was in a really horrific accident. And the video that follows is a little bit of the medical aftermath of that accident. So here we go.
The driver of the car escaped with minor injuries, but Billy was rushed to the hospital.
I got the phone call saying, Tony, okay, you're sitting down. Billy's been in an accident. And I thought they were joking, you know.
I talked to Tony and he said Billy was on his motorcycle. He was hit by a car. He's in surgery. We don't know if he's going to make it.
Dr. Jack Moshine received an urgent call from a doctor in the Cedars-Sinai emergency room.
I went down to the emergency room, and he takes me to this room, and there's this man lying there with bleach blonde hair. And I looked at him and I said, "You brought me down for this bum?"
Okay. I see Mark's face. Yes, so the doctor, whose job it is to save lives, said, "You brought me down here for this bum," because he didn't know that Billy Idol was Billy Idol. Now, whether Billy Idol was a famous musician or whether he was a school teacher or a man who was in fact living on the street doesn't matter. So there is clearly discrimination in the healthcare system. And another scenario that I wanted to share is one that unfortunately hits very, very close to home. So we already know that there's discrimination in the healthcare system. Again, this man looked at Billy Idol thinking that he was probably homeless or maybe low income and decided that it really wasn't worth his time. Now, that happens to people based on, of course, income and of course, race, gender identity, orientation. Oops, I'm sorry. So I wanted to share briefly a story. As I said, Rana Zoe Munchin. I'm not sure if people have heard this story, but it did make national news. We all called her Zoe. Zoe is one of my sisters from Wellesley College. She's class of 2011. So I'm an older class, so we did not overlap at Wellesley, but nonetheless, the sisterhood, the siblinghood is the siblinghood. And we were able to meet online and develop relationships because Facebook and technology brings people from all over the world right there to you. So we developed a relationship and I crashed their reunion so that I could meet Zoe, who is on your left, and her best friend, Mimi. You see me in the middle doing our little Wellesley salute. So when COVID hit, Zoe had called 911. Something was wrong. She wasn't sure. She called 911. They came and they told her that she was having a panic attack. It might be asthma. And they left. She went to the hospital later on. This is her second attempt to get help. And they sent her home. They didn't have enough COVID tests. They also said, well, you don't really fit the high risk profile to get a COVID test. And they had her sitting around in the hospital. She didn't want to stay there because, you know, it's a pandemic and she didn't want to get COVID. So she left. The next time she went to the hospital, and actually before she went back, she had posted something on Facebook saying the profile of somebody who was at risk for COVID. And she said, I tell you, I've never been this sick though. And then she was finally admitted into the hospital, where she then ended up in a coma on the ventilator. Senator Chuck Schumer stepped in to advocate for Zoe to get treatment, to be moved to another hospital. And unfortunately, Zoe passed away. She had tried several times to get a COVID test. But one of the problems is that she's Black. People do not listen to Black women. It turns out that Zoe, her sister, is a nurse. Zoe lives with her sister. So while her sister was the nurse who developed COVID or rather contracted COVID and Zoe got it that way because Zoe wasn't the nurse, because Zoe didn't fit that profile, because they didn't listen to Zoe, because they didn't believe Zoe, because they thought that Zoe might be over exaggerating. Zoe, unfortunately, is no longer with us. There are so many stories that start and end like this. And so many of them are women of color. This is why it's really, really important for people to listen to patients. It doesn't matter if you think that they don't fit the profile. It doesn't matter if you think that they might be exaggerating. They know their bodies. They know when something's wrong. Like, I know my body better than anybody else does, right? So I'm the expert on my body. And it's important for us to, there's so many things that were said earlier that I want to circle back to. One of them being people who have, are marginalized. How are we fighting for them? When you think about public health, because this is where my background is, of course, public health. If you think about public health, the idea is do the most good for the most amount of people, right? But what does that mean for the minority? If we're doing the most good for the most amount of people, and most people, let's say, are white, well, then what happens to the people of color? If most people are heterosexual, if most people are cisgender, then does that mean that we're pushing people of color, people who are sexual minorities, off to the side? Even if it's not intent, we really need to think about. So the reason why I do this work is because we need voices, we need stories, we need people who will stand up and support and advocate for those who cannot advocate for themselves, maybe who do not know how to advocate for themselves, people who are not listened to. And when you think about how much people of color have informed the medical field, Henrietta Lacks, right? Anarcha, who was one of the enslaved women that Dr. Marion Sims practiced his techniques on, right? Without anesthesia, because again, people thought that, well, as a person of color, as a Black person, Anarcha didn't feel pain, didn't deserve anesthesia. So we have people of color who have been served as cadavers, right? Their bodies have been exhumed from graves. Enslaved people were given to the doctors to experiment on. All of this informed, right? We got a lot of medical knowledge as a result of this. However, the people who have informed the medical field are by that same entity. So as far as health literacy, and another concept I wanted to bring about is intersectionality. There's different components within health literacy, right? We know that there's a fundamental component, which is being able to understand language. There's the science component, being able to understand, the body and health. There's the civic component, being able to interact with people, being able to find information, verify information. And then there's the cultural part. And this is where we need the assistance from the people who are doing the communicating, the people who are interacting with the patients. So the cultural literacy part it taps into the values that a group has, norms, beliefs, language, right? And it is to understand the values, to understand, and understanding that one message may not fit all. Communicating with a largely Hispanic population might have in fact, it would have very, very different points than if we're communicating with a largely Asian population. If you're talking to a largely LGBTQ population, it's going to be drastically different than if you're talking to a largely cisgender heterosexual population. Now, within that, not everybody in the LGBTQ community is the same. We kind of, somebody mentioned that earlier, right? Within the Hispanic community, right? There's diversity within that. There's diversity of thought. There's diversity of racial diversity. There's people with different ability statuses. And so we might think of, okay, well, we're going to gear something towards Black people. We're going to gear something towards Hispanic people. And then we'll just do this blanket statement, but it's not enough. We need to make sure that we're being intersectional, that we're being inclusive. When we saw Black Panther come out, and a lot of the Black community was incredibly excited, of course. And then Wakanda Forever came out. Black people were incredibly excited. But you know who else was excited? The Hispanic community, Namor, right? Or maybe it's Namor, depending on if you're a comic book fan or if you're the Marvel movie fan. I'm not getting into that. But representation matters so much. And it's so important to make sure that we have that representation in the doctor's offices, in the services, the health provider services, everything from the person to answer the phone, to make sure that the person that's calling is being respected down to their gender, the way that they're being referenced. Is it Mr., is it Miss, is it mixed, is it doctor? Right? To the person that's going to be taking the blood pressure, to the person that's going to be asking and answering the questions. All of this, we need to make sure that people are informed, that people are well trained, that people have the tools to be able to effectively deliver culturally competent, dare I say, culturally proficient healthcare. And I know that there's not a lot of time for me to have this conversation, and you know, I could talk about this all day. In fact, that's what I do. I do talk about this all day with Left Turn Village. But the last thing I want to point out is we also have to be very, very careful with respect to language. We often end up saying things that might be hurtful, not intentionally, but a lot of our language is colored by racism or sexism. A woman is hysterical. Really? Okay, thanks. And we'll say things like, oh my God, that's insane. That's so crazy. Whoa, okay. And I know that we don't necessarily mean negative things by it, but if you are a person that is neurodivergent, if you are a person that does have mental health conditions, hearing those languages, hearing those terms might be triggering, and it might make you not, it will impact the way that you receive help. So I don't want to take up more time. I know that there's a lot more that needs to be said, and the people that are on this panel are amazing, and I'm so grateful to be a part of it. But I'll pass it back to Jade, and thank you so much for having me.
Thank you so much, Dr. Oredein. That was an amazing presentation. And once again, we appreciate all the work that you're doing in your community and here with us today. So if anyone's interested in finding out more about Dr. Oredein and her work, as she said before, please check out Left Turn Village. They do some amazing, amazing work, and you can hear her talk more about all the amazing things that she discussed today. So next up, we have the wonderful Mike Keogh. We're gonna share our presentation once more. Get ready here. All right, so Mike Keogh is a storyteller, a public speaker, and a photographer that weaves personal and community narratives to create local dialogue on equity, inclusion, anti-racism, and collaboration. He's the founder of I Am Not a Virus, a co-op that highlighted Asian American stories across the diaspora and successfully advocated for the No Hate Act. Through partnerships, they created a coloring book of Asian American heroes that included Southeast Asian, South Asian, LGBTQIA+, and multiracial from STEM, public and art backgrounds, and a mental health workbook for Asian Americans that has been utilized in over 24 universities. As a co-founder of Make Us Visible, he helped successfully advocate for bills in Connecticut and New Jersey for the inclusion of AAPI history. He currently serves on the Governor Lamont's Hate Advisory Crimes Council, and he was recognized as a 40 under 40 for Connecticut class of 2023. So please join me in welcoming Mike Keogh.
Thank you, Jade. I'm really grateful to be here with all these amazing panelists for such an amazing conversation. So my name is Mike Keogh. I am a father, a husband, and a child of refugees. During pandemic, I created a photo series of Asian Americans that ask, if you're not a virus, then who are you? And what do you love about yourself? And during this process, I also asked community members to share when have they felt anti-Asian racism. And during this process, many Asian Americans didn't have the language to say that something they've experienced was racist. We didn't have the reference points on where we exist. And I can tell you that I've grown up with anti-Asian violence. COVID-19, the violence of COVID-19 wasn't new to me. I experienced anti-Asian violence when we moved to multiple homes. By the time I was 16, we lived in 5 apartments and we would leave every time the rent was high. And we tried to remain in the same school district, so we would lie about our address for access to better public schools. I felt anti-Asian racism when I took my grandma. As the eldest, I would take my grandma to the doctor and translate for her because my parents worked 60 to 80 hours a week. And I felt anti-Asian violence, and I felt both targeted and invisible. And that's what anti-Asian violence does to you. It makes you feel invisible and a target. And I remember bringing her to her doctor. It was the 3rd doctor in 5 years because she was on Medicaid, in the same office. And her doctor was helping us with a visa so my grandmother's sister could come and keep her company. And I wrote the doctor, and I was there in the room, and the doctor was so happy to give us this note so my grandma could go home and speak Ching-Chong to her sister. I was 20 years old, and I had no experience to advocate for myself in that room. I was afraid if I said something, they would take this letter away from my grandma, and she wanted to see her younger sister. So like, anti-Asian violence was never new to me. It was something I existed with, but I didn't have the language to call it. That moment sticks with me every time I think about, what it feels like to be invisible and to advocate. That shame, staying quiet, has stayed there. And during COVID-19, a lot of this came out. And, I was familiar with Bandy Fong, who was a 13-year-old Cambodian American like myself, who was killed by an 11-year-old in 1989 during a wave of anti-refugee sentiments. So this is what kind of brought this project together, was knowing that there is so much our community has experienced, but has remained invisible. And during this project, a big part of it was the intersectionality and where our stories exist. And to be Asian American means that we are South Asian, Southeast Asian, East Asian, LGBTQIA+, adoptees. And oftentimes none of those voices are shared. It's usually from an East Asian perspective. So I'm Not a Virus came through a Southeast Asian American lens that was built around mental health, around our personal stories, and being able to move forward together and what that meant to come together and collaborate. And during this process, in the spring of 2020, my friends came up to me and said, Mike, can we do one called I'm Not a Threat? And so again, we did another local kind of photo shoot with African Americans and the Black community in my area. And we had over 30 people attend for this photo shoot, and they included adoptees, LGBTQIA+, and immigrant stories. And during this process, my friends and collaborators told me, Mike, we can't have pictures of people smiling and just people smiling. And so we did two portraits. We did a smiling portrait and one where it was black and white and starkly different, where no one is smiling. And the reason behind that was that members of my friends in the African American community felt that they had to smile to make people feel safe around them. You know, for Asian Americans, we had to wear our masks to make people feel safe around them. So that's why we did two separate types of photos. And my friend Adrian came up with the question of, when did you first find out you were Black in America? And I am there as an Asian American, taking these portraits and listening to these interviews. And one story really, really resonated with me. It was the story of a man who, when he was a young boy, was accused of plagiarizing. And his parents and his grandparents actually went to the school to have this conversation about why the only Black child was accused of plagiarizing in a room full of white students. And for me, it stood out to me because as an Asian American, when you called my house, my grandma spoke 5 languages, but she only spoke broken English, right? She could speak 5 languages, but only broken English. And every time they called, they would talk slowly to her. So they assumed that I plagiarized too. But my parents didn't recognize it as racism. They saw it as, my goodness, my child is so smart. You know, they're working 60, 80 hours a week. So they thought I was studious. And when I heard that, it changed the framework of my own experience. That story made me rethink about my Asian American experience and the stories we don't tell each other to remain safe. You know, I knew where not to go because I knew where violence was, but I didn't know that I shouldn't be talking about oxtail and chicken feet at school as one of my favorite meals. You know, so that brought up the mental health workbook for us. And the mental health workbook was for Asian Americans through literature, through art, and through poetry, for people to discover their own experiences so they can have the language to advocate for themselves. Because if you don't know who you are, you don't know what to ask for. So that book was a labor of love. We did it with UConn Asian American Studies Institute. And it allowed people, like one of my favorite questions to ask Asian Americans now, right, is when you were younger and your parents had to drive 2 hours for groceries, what did they pack in the cooler? You know? And so many people talk about pork, or they talk about culturally relevant foods that we don't have access to at home. And this affects our health disparities, you know? It affects where can we grow things? Where can we find things that we're familiar with? And these were the tools we used to pass legislation by activating communities through intersectionality, to allowing their stories to exist and just be, and to have stories of joy as well. You know, I am so proud to be who I am, to grow up in a refugee household, that I wanted to claim that heritage for myself and for others to find the space where their stories can exist fully, independently, and full of joy and pain and the rest of the human experience. I think one of our speakers earlier talked about how communities were already doing this type of work. You know, I came from this space as a photographer. I wasn't in social justice. You know, there were things I would donate to, but I wasn't in this space, and I came here as a photographer because that was my skill set, and I wanted to do this type of work. And I was able to find a community and find people that were doing this work across different sectors. And so recently I started a new position at the Connecticut Historical Society as the community engagement manager. And I tell you, in this space that I'm in, it was so helpful to have funding. There are so many community members that are doing this work already, but to have funding to allow my ideas and like community ideas to move and mobilize, it's fantastic. The programs that we're working on right now is one for Asian American and Black students, and it's the first cohort. Our second one will be for Asian American, Black, and Latino students. But this is a class for a leadership training where these young folks have access to mentors that look like them, that understand their experiences so they don't have to repeat themselves, and that they get to read graphic novels and have an affinity space where they can see their own experiences there. So they can see this away from, from a white lens. They can see this from an Asian American lens, a Black lens. And to be able to go back inside the community to ask oral histories, to have conversations that are culturally relevant. I can't stress that enough, is that cultural relevance. I had troubles asking my parents about their personal histories because I never saw them anything beyond war-torn people. I've never seen them besides like people that worked so hard and that survived the war. So I didn't know what questions to ask. And recently I did ask my mom, because for this project, I had to ask my mom questions. And we ended up talking about my great aunts, because my mom shared that my grandma raised all her siblings. And we talked about, I asked her, well, where was my great aunt in this? She's older than my grandma. Why wasn't she raising her siblings when her parents passed? And my mom shares that my great grandmother was a landowner in a region of Cambodia. And during this process, she was a landowner, she was a farmer, but she owned land, and her brother-in-law was really jealous. So when the Khmer Rouge came into power, they ended up going there, and my great aunt hid some gold. She hid some gold, and her brother-in-law shared with the Khmer Rouge where my great aunt hid it. So they executed her publicly in the fields. And my great grandmother sees this. And while she is watching this happen, she starts yelling, and they kill her too. And my mom's nephew is the only witness in the village. And neighbors grabbed him and held him down so he wouldn't make noise, and he survived. And this is the first time I'm hearing the story, and I'm 37, 38. And the story goes, my mom shares that in 2000, she was at a temple in Danbury, Connecticut. And in Danbury, Connecticut, she meets this woman with a distinct earring that my mom recognizes from this village. So my mom speaks to her and asks, sister, where are you from? And they start talking. And eventually they get to the village, and she asks my mom how she knew about this. And my mom says that, well, my aunt used to live there, and I used to visit as a child. And the woman asks, who was your aunt? And when my mom shares the name, she got really quiet, and she excused herself and left. Shortly after, her and her family actually moved out of Connecticut, out west. 3 months later, my mom's on the phone with her nephew from Cambodia, and she asks, do you know these people? These are their features. And he responds with, yes, they were part of the people that killed my grandmother. And when my mom shares the story for the first time as an adult, I felt that the war was much closer than it was. I felt that the war was immediate, that it was a year ago and not 40 years ago. And my mother has held on to this story for years, and the way she shares the story is nonchalant that this did happen to me. So I asked her, were you mad? And she says that you can't be mad anymore. It was a different life, and people did these things to survive. And so you have to let go, because we don't want to carry that karma back with us, And I was wondering, while my mom was sharing this, what mental health resources would have done for our family years ago. How would I have taken the story? Because my first question that I asked her was like, who are these people? Like I was going to do something about it, it was silly. But, I think this is why culturally relevant help for mental health services is so necessary for our community, because it doesn't just affect the people that have been in those spaces, but the ones they raise after. And my eldest, she's a mental health therapist now, who is a woman of color, and which was important. And during this process, I found out my own triggers, that were Yeah, so it brought up my own triggers of my young ones running up the stairs and why I felt a certain way when I would hear this. But I think, you know, I thank you for your time today. I think with storytelling, it provides us this framework where we can enter and take the space that we so rightfully deserve and to advocate for ourselves. All right, thank you.
Thank you so much for sharing your powerful story, Mike. Anna also shared a link to Mike's mental health resource if anyone wants to check it out in the chat. And last but certainly not least, we have the wonderful, amazing, talented Mark Travis Rivera. Mark Travis Rivera is an award-winning professional storyteller, and telling stories is at the core of Mark's purpose in life, as he describes it. A graduate of William Patterson University, he earned a bachelor's in women and gender studies with a minor in public relations. In 2013, Rivera received the Student Government Association's Lifetime Achievement Award for his commitment to the William Patterson community. And in that same year was honored with the Campus Pride Voice and Action Award for his work with the LGBTQ+ community. In addition, he recently won the Audre Lorde Award for Social Justice from John Jay College of Criminal Justice, CUNY, and the Lavender Legacy Award from William Patterson. His writings have appeared in the Bergen Record, Herald News, the Star Ledger, Fox News Latino, and the Huffington Post. As a speaker, he's spoken in front of crowds at various institutions of higher learning, including Harvard, MIT, and NYU. His TED Talk, Embracing Yourself, Embracing Your Potential, was an absolute hit in 2014 at the Bergen Community College. His debut collection, Draft, An Imperfect Collection of Writing, was published in August of 2017 through Amazon. And in 2020, Rivera launched his wellness podcast, Marking the Path, which is available on Apple Podcasts and Spotify. We are so excited to have you, Mark. Thank you so much for being here. Ooh, I think you're muted.
Sorry. You see, you would think the person helping with behind the scenes stuff would be able to make sure you understand. Hello, Jay. Thank you so much for that wonderful introduction. And thank you so much for facilitating and guiding us through this event today. I also want to give a special thanks to Anna and Helene and everyone at SAOF for inviting me today. For those of you who are left in the conversation, I know it's been a long day and it's been a long presentation, so I want to make this as painless as possible. But I want to start off with a piece from my book, Drafts, An Imperfect Collection of Writing, to kind of set the tone, because what kind of storyteller would I be if I didn't tell a story? Ode to my body. Forgive me for I have forsaken you, throwing you between the lion's jaw, pushed you to the core of your being until you began to break, crippled, frail, sore, bruised, stiff. Still, I adore you. We met at conception, you were premature, given the task of being my keeper, of holding my soul within you, tired, beaten, swollen, limited, exhausted. Still, I adore you. For without you, I could not be the dancer. You have given me the facility to live my dreams. I adore you in all of your glory. No matter how worn out you are, no matter how much your stomach expands, no matter how your muscle spasms interrupt my sleep, remember that I adore you, even as I run us both to the ground. You see, as a Latinx, queer, disabled, gender non-conforming man in America, I am often seen as a freak, a crippled, a person who must not know what they're talking about. You see, growing up, I didn't see brown, crippled, queer boys on television screens or in books and movies, in comic books. I exist at multiple intersections. And I often say that at the intersection of where I exist is where I will live and die. My mother's greatest concern for me is my safety as a gender non-conforming person. In America, when the life expectancy of a Black and brown trans woman is 35 years old, anyone who dares to defy the binary of gender has a target on their back. So not only is my gender expression a target, not only is my brown skin a target and my perceived sexuality a target, I am forced to navigate a medical system from the moment I was born as a premature baby, when my mother gave birth to me, her only son, 5.5 months. weighing 1 pound in 1991. Statistically speaking, I should be dead and not speaking to all of you today. Now, as a 31-year-old professional storyteller and diversity, equity, and inclusion consultant, I navigate the healthcare system through a very different lens this time. Not as a premature child baby, but as the first person in my family to graduate high school, and the first person to graduate college, and the first person to have a creative entrepreneur career. See, so when I enter the mental health clinic I go to deal with my depression, when I enter the LGBT clinic I go to for sexual health and primary care, I recognize that my education is a privilege. I recognize that people will see me, but not always hear me. I recognize that the embedded shame of having to go to these clinics, right? The disparities that I have to deal with as a low-income person of color who is queer and disabled in this country does not escape me. No matter how many awards I have been given, no matter what institutions of higher learning or corporations I've spoken at over the last few years of my career, or in the decades since I started my career, none of that matters in the healthcare field. Because my resume is not visible on my charts. My LinkedIn is not visible on my chart. All they see is this brown skin that often wears makeup and pretty nails and dresses and high heels. They see a strut and think I have a gay walk and not realize that it's my cerebral palsy impacting my walk. You see, as a diversity, equity, and inclusion consultant, I work with corporations across sectors about the importance of inclusive language, the importance of communicating with people and meeting them where they are. You all are seeing people more often than not at the worst moment in their life. And you have a choice to make as a healthcare provider, as a health equity practitioner, as a doctor, even the receptionist, even the medical assistants. Every single person who works in the hospital has an opportunity to save a life. Because the difference between life and death can simply be hearing me, believing me, trusting that I know my body, this crippled, frail, bruised, stiff, sore, swollen body. I know this body of mine. And yet all you can see are the things that make me marginalized in a country that has shown time and time again that my life doesn't matter. That my access to health, that healthcare, rather than being a universal right, a human right, are often left to peddle with health insurance companies and premiums that we can't afford, or employment-based health insurance that can be taken away in an instant the moment you are fired or laid off or let go. But you all, as health professionals, have an opportunity to really close the inequity gap that we experience in our healthcare. You know, when I went to see my psychiatrist a few months ago, it was our first session together. She was taking notes. She, a Black woman, an Afro-Latina in Morehouse medicine, paused me and said, "Do you always speak this fast?" And I said, "Oh yes, honey, I'm Puerto Rican and I'm from Jersey. You know, talking fast, talking with my hands, that's what we do. It's cultural." She said, "I think you were misdiagnosed with bipolar 1 because your psychiatrist in New Jersey didn't take into account the cultural elements that makes up who you are and how they perceived your behavior in that intake was difficult. They saw me as pressured, as someone who's being manic, who's having extreme mood swings." But it took one Black woman who's doing her residency at Morehouse Medicine to pause and ask me a culturally relevant question: "Do you always talk this fast?" I said, "Yeah, I'm from Jersey. I am Puerto Rican. It is what we do. Talking with my hands is pretty much what I know. And in my family, we don't call it yelling. We call it communicating." But so many times I am the youngest person in a room talking to leaders and CEOs across industries. And more often than not, I am the only person who exists at the multiple intersections that I exist in. And that's why this book was so important for me to publish. This is why my podcast exists. This is why my other projects exist, because we need to see ourselves represented, not just at our worst moments. We need to see ourselves represented in positions of leadership and influence. To the white healthcare professionals on this call, I beg you, how will you use your positionality and your influence and your privilege to make a way so that the next generation of healthcare providers are more diverse, more culturally competent, and more human-centered? The best medical experiences I ever saw, or ever experienced, I should say, in the medical industry were not from the most diverse person, the person who understood how to do inclusive language perfectly. It was from the person who saw my humanity. It was from the person who took the moment to ask me, do you understand what I'm saying? Do you have any questions? Is there anything I can clarify for you? As a trained journalist, as someone who's a trained professional in marketing communications, I understand the power of language. And I'm telling you now, jargon is not for people that you're meeting with at their worst time. Jargon is for your research and academic papers to get published and stored away at the ivory tower. I want you to communicate to people as people, knowing that you are seeing them at their worst moment, giving them the worst news of their lives. I need you to see their humanity. I need you to see yourself in them. Not jargon. I need you to challenge your implicit bias. I need you to recognize that simply because you are educated and claim to be a Democrat or progressive does not mean that you are automatically an ally. They often say the most dangerous person in America today is the uneducated, white, poor, rural man who is a MAGA supporting, Trump voting person. But I'm here to tell you the most dangerous person in America is a so-called progressive, educated, white person who should know better, but doesn't always do better. So you who know better should do better, and you can make a difference between someone surviving a visit to the hospital and someone not surviving it. That you can use your positionality and privilege and platform to advance health equity. That is not a you problem or a me problem, it's an us problem. COVID-19, a pandemic for all of us in our lifetime, has changed the way we live, love, and lead. And yet, the most glaring thing to me that the pandemic taught us wasn't the bigotry that I already knew existed. It wasn't the rise in anti-Asian hate and Joy Floyd's murder and the rise in queer antagonism. It was, and it continues to be, how broken our healthcare system is. We saw nurses and doctors literally dying in droves. We saw people burnt out and being overwhelmed by the grief because our healthcare system is broken. And you, the frontline workers, you, the people responsible for enduring a pandemic of multiple levels, are tired. You deserve better. So do your patients. So it's not just you or me, it's us. Together, collectively, we can embed equity in our healthcare system, in our health communities. We together can change the narrative. We together can increase representation of diversity. And it's not just about seeing people who look like me or talk like me or know what it means to be queer or gender nonconforming. It's important to have people who can simply listen. And when you have more diversity, when you increase the people of color and LGBTQ people and disabled people in your industry, that you make sure you're creating an environment that retains them. That you are creating an environment that is inclusive. Because only then can we begin to do the work of equity. I don't want to be seen, I want to be heard. And more importantly, when I'm heard, I want to be invited to the table so that future generations who look like me will not experience the bias and harm that I experience in the healthcare industry. This isn't meant to place blame or shame, but rather, together, we can create a generation of people who trust the medical industrial complex. We can save lives, and we can stop preventable deaths from happening. Thank you so much, Jade Dickinson. Thank you so much to everyone for being part of this event. I'm going to pass it over to you, Jade. Thank you, everyone.
Thank you so much, Mark, for a profound way to close us out today, this amazing session. So we're sorry we went a little bit overboard, but I'm actually not sorry because it was incredible and needed and amazing. And the voices in the room today were absolutely truly profound. So I just want to say thank you again to all of our panelists. We're so deeply honored to have the opportunity to bring your insights to people on the front lines of health communication and health literacy. We have a few additional thank yous to shine light on the off-screen efforts. We'd like to thank the co-creators of the Symposium who came together in 2020 to make this event a reality. Maya Reed, Tomi Santan, as well as SEA board member Valerie Williams-Sanchez and SEA board president Derek McCracken, who's been behind the scenes working hard on technology today. So thank you so much, Derek. Thank you to everyone in attendance. We look forward to seeing you for the final session of this symposium. Both are at the same time, 3:30 to 5 p.m. tomorrow.